Pneumonia is the single largest infection that causes death in children all over the world. Meanwhile, pneumonia can be treated and it is preventable. So the question is, why will a child be allowed to suffer from pneumonia or even die from it? Juliana Way is the name. And as usual, I am here to enlighten you on a very important topic in children. So the topic for today is pneumonia. The primary organ that helps us to breathe normally is called the lung. Every human being has two lungs, one on the right and the second one on the left side of the chest. When you touch a newly baked bread, you will notice that the bread can be squeezed easily. It feels soft and light. But when you leave the bread for some days and it begins to go bad, it will become stiff and hard. A healthy lung is like a freshly baked bread. It feels soft and fluffy. When you breathe in, it will open up, collect oxygen, and then remove carbon dioxide, which one breathes out through the nose. So it is very elastic. The parts of the lungs where oxygen and carbon dioxide are exchanged, we call it the alveoli. And the moment germs get in there, they cover the place where air is supposed to enter. Now the lungs become stiff like old bread. And that becomes a problem. The germ will cause pus and something that looks like water to stay in the alveoli. And the person will not be able to breathe. Then we start seeing all the signs of pneumonia. Pneumonia is caused by germs. It's caused by viruses, bacteria, fungi. Influenza is the commonest cause of viral pneumonia. And Streptococcus pneumonia, Haemophilus, chlamydia are also common causes of bacterial pneumonia. Some children are more likely to suffer from pneumonia than others. If you remember in my health talk on childhood immunization, I told us that saying no to immunization is like building a house without doors and locks, and then you keep the doors of your child's body open to diseases. A healthy child fights off infection easily, and when children do not have proper immunity, they are at higher risk of developing pneumonia and other diseases as well. Now, this happens when a child is not given breast milk only in the first 6 months of life, the child is not given all the vaccines for the child's age, or the child is malnourished or undernourished. Also, a child who has measles. Please know that when children die because of measles, the common cause of their death is pneumonia due to that measles. Remember that measles affects the body entering through the respiratory system. So from the nose and all that, it gets to the lungs. It will cause infection in the lungs, and that is what kills children with measles more. So get to watch my health talk on measles, you'll understand more. A child with symptomatic HIV will have low immunity, so that child may have pneumonia. A child who lives in a place with indoor air pollution caused by cooking with firewood or bad stove. A child that lives in an overcrowded room, children that live with adults in the same room, or children that live with parents that smoke cigarettes. All these things will increase the likelihood of a child coming down with pneumonia. The germs that cause pneumonia can spread 2 different ways: through airborne droplets. If a child or an adult has pneumonia and coughs, the germ will come out. If it touches another person, the person will come down with pneumonia. Also, pneumonia can be spread during childbirth. If a woman has any of the germs that can cause pneumonia in the child, and the child contacts that germ during childbirth, that child can come down with pneumonia. And the pneumonia in children is common when children are under 5 years of age, and they present with the following. Number 1, fast breathing. When a child breathes, fast. Another thing is what we call chest indrawing. When the child is breathing, the skin in between the ribs will be going in. When a child has difficulty in breathing, when a child has cough with fever or without fever, an older child can complain of chest pain, or the child makes certain kind of noise while breathing. This is called wheezing. Very ill children will not be able to eat or drink when they have pneumonia. Body weakness, vomiting, diarrhea. A child can even go unconscious from pneumonia or have convulsions. So please know that pneumonia can present in different forms. And pneumonia is supposed to be treated in the hospital, but some people will go to drugstores and start buying drugs. This is not safe. Once you notice your child is not breathing well, or the child has other symptoms I mentioned, take that child to the hospital immediately. As an adult, when you struggle to breathe, you know how uncomfortable you feel because you're not getting enough air. So imagine how a little child will feel not being able to breathe enough air. Please don't waste time. Pneumonia is one of the killer diseases in children. Take that child to a doctor. The doctors that take care of children are called pediatricians. Now, depending on the severity of the condition, the child may need oxygen, antibiotics, drips, and so on. These are things you cannot do at home. Please take your child to the hospital for treatment. Pneumonia is preventable, and immunization against Haemophilus influenza type B, pneumococcus, against whooping cough, against measles is the most effective way to prevent pneumonia in a child, as well as adequate nutrition. This will help to build up the child's immunity. It starts with exclusive breastfeeding in the first 6 months of life. And again, reduce air pollution inside the house, encourage good hygiene and cross ventilation wherever children are. Another key to prevention is that you have to encourage proper hand washing, frequent hand washing, because the germs that cause diseases are carried by hands as well. So you can touch a surface that has this germ. If you don't wash your hand, you can touch a child, the child will come down with it. So please, hand washing, very frequent hand washing. Then prevention of HIV in children. A mother who is HIV positive can deliver HIV negative babies. Please get to watch the health talk I did on this topic. I explained what you would do at every stage. Then, but in children who are already affected with HIV, there's no problem. That child is supposed to be going to the hospital for follow-up, and the child will get to be taking a particular antibiotics that will prevent the child from coming down with pneumonia. Okay? As an adult, you're caring for someone who is sick, wash your hands before you touch a child. Or when you blow your nose, wash your hands before you touch a child. Remember I said at the beginning that pneumonia is the single largest infection that causes death in children all over the world. So what that means is that if you can successfully prevent pneumonia in children, you can successfully reduce death amongst children all over the world. Once again, knowledge makes the difference between a healthy child and a sick child. Stay connected, stay informed. Please use the comment section for your questions and your comments, and do well to subscribe to my channel. I hope you found this health talk very helpful. Once again, thank you very much for always coming around to learn. Thank you very much, and see you again.